Hi, folks. I'm Rich Lucy, Senior Prevention Program Manager here at the Drug Enforcement Administration's Community Outreach and Prevention Support Section. Welcome to this episode of Prevention Profiles Take 5. I'm very excited about today's guest. I've actually had him on my go-to list for a while, and we finally have been able to make it happen. Stevan Veldkamp. Let me tell you a little bit about Steve, and then I'm going to bring him in. Dr. Stevan Veldkamp is the Executive Director of the Penn State Timothy J. Piazza Center for Fraternity and Sorority Research. Under his leadership, the center is dedicated to creating effective strategies to empower students to address hazing and dangerous drinking. With 30 years of extensive experience in student affairs, Steve earned his doctorate in higher education from Indiana University. With that, Steve, welcome to the podcast.
Yeah, thank you, Rich. Happy to be here.
Absolutely. And I imagine it might be a little bit of a busy time for you. Last week, I was at the American College Health Association's annual meeting, their conference, and the Anti-Hazing Act was certainly on people's minds. So I'm presuming that's causing some busyness for you.
Absolutely. Excited that that bill has passed and a lot to work to do to define what research-informed practice is.
Yeah. Well, I'm sure we'll get into a little bit about that in our interview. But before I get into the questions that I do have for you, let's start by you telling us a little bit about the Piazza Center.
Thank you, Rich. The center founded and refounded actually at Penn State. It's an old soul and a newer research center. And our founding at Penn State, obviously, in our namesake, it was out of tragedy, right? In a major hazing incident. And really our goal is to understand the why behind it and what are the effective prevention measures that can really save lives and prevent hazing from occurring, hazardous drinking from occurring, other resulting behaviors. We care deeply about students and really want to partner with students to figure out what those prevention strategies are that create real change. So that's, in a sum, what our center's real focus is and our dedication to creating meaningful and transformative experiences in fraternities and sororities, student organizations, athletics. It's very applicable work, really, in any student community. So,
well, thank you for that. As you mentioned, and I know that I've said this in this podcast and many other venues, that oftentimes in our field, it unfortunately, efforts or initiatives are created out of a tragedy, and that is certainly what happened with Timothy. I don't know if you want to talk a little bit about Timothy. It was a very high-profile incident that occurred.
Yeah. Totally, Rich. Very high profile, but also the mimic behavior that's happening across college campuses is not unique to fraternities and sororities. It's not unique to Penn State. It's literally across high schools, colleges, and universities. And so looking at these root causes, I think, is our focus, to pull those apart and then look at the prevention measures that pair with those things so we can actually engineer cultural change on high schools, colleges, and within organizations.
Yeah. And, I know from my time, and I think we'll get into this a little bit, there's a bit of a misperception that it's like all college fraternities and sororities are engaging in this behavior. It takes, just one high-profile event where it feeds into that, I think, that misperception that, they're all engaged in this, and it's just not true, that's just not the case, right?
Correct. We actually have a project called the Scorecard Project, where we're looking at organizational findings that campuses are producing. And the percentage is fairly low in terms of the number of hazing incidents. Alcohol incidents are much higher, right? Mm-hmm. But the hazing incidents are much low. And then the aggravated hazing incidents, or the more serious that involve forced consumption of alcohol, are less than 1%. But again, when you are talking about large populations on college campuses, that's still meaningful numbers that we need to pay attention to. And so, again, in our tracking, while it's small, we still need to focus on these things. And we have cultures that, when they get out of hand, can grow, and there can be a larger number of those alcohol-related incidents that pair with those hazing incidents.
And I'm going to jump into my first question. I have in the back of my mind that hazing is not just among fraternities and sorority members. I mean, the issue of hazing, cuts across social clubs, sports, athletics. It's not, fraternities and sororities don't have a monopoly on it. Let's just put it that way.
Correct. And actually, Rich, if we can even back up a little further, that this is mindsets and behaviors that are happening in middle school and in high school. And so universities, college and universities are inheriting a mindset and inheriting students that have already experienced bullying and or hazing and or both. And so thinking about it from a larger view or a landscape analysis of the feeder schools that are coming in that are populating our college campuses, where students are coming in with those mindsets and or having been susceptible to hazing and bullying, like I said. And so thinking about that and then how they join organizations and then they promulgate those types of activities because they're like, oh, this is what you do in college. And so I think there's a really important opportunity that we need to span out our prevention programming and look at our, especially for college and universities that are listening into this, what are those opportunities to work with, especially those feeder high schools that are your go-tos, and what incidents are happening in those spaces before you get your college students, right? And so thinking about it in a wider span. And in fact, a lot of college and universities are, when they built out their prevention programs, are starting to work with those feeder high schools.
Well, all of this is great context for the interview. So I'm going to jump in now to our first question. We touched on the fact alcohol and other drug use. So I turn to you and ask, what are some of the current research findings that the center is seeing around alcohol and drug use trends among fraternity and sorority members?
Yeah, and I'll start out with the ACHA data and looking at that fraternities and sororities, as well as some other groups on campuses, are drinking at higher rates and potentially more binge drinking. Coming out of COVID, we really saw, I would say, a tale of two tales. One, students moving in a direction of non-drinking, and another where their episodic drinking got more serious. And so it seemed to almost like polarized views. And then since that, we are looking at, again, kind of a more normal or pre-COVID numbers in terms of excessive drinking and episodic drinking within fraternities and sororities, sometimes to double that of some of their peers in some cases. And again, you've already mentioned it, Rich, but not all fraternities and sororities do this, and not all campus communities do this either. And so you really need to pay attention to, I would say, more localized data than some of the national data. It's a good frame and baseline for regions and or campuses, but you really need to understand what's happening on your local campus level, and then in subpopulations within your campus, including subpopulations within your fraternity sorority community. You can't paint organizations with the same paintbrush, unfortunately. And so I think it's really important to figure out different game plans with the different subpopulations within your fraternity sorority community, as well as with your student organization community, your ROTC programs, your athletic programs. It's a major undertaking, but it's so important to do to get it right.
Well, I'm glad that you said it. I didn't have to even bring up the strategic prevention framework, but right there embedded in what you were saying is that we know that, first of all, local, folks at the local level solve their issues best. And ultimately, you need to do the needs assessments or the surveys, the snapshots to get the data, because that's what's going to drive your programming. Like you said, national data is great to have a bit of a comparison, but you really need to be doing this at the local level.
Yeah, I mean, NCHA findings say that fraternities and sororities, only utilize 8 out of the 11 safety protocols as an example. So limiting alcohol consumption, avoiding drinking games, pacing oneself, choosing not to drink. Those are all very important strategies that in fraternity sorority space could be employed. But again, looking at that in terms of those other spaces in your campus where you have heavy episodic drinking, where some of that same thing is true for those organizations as well, and then coming up with really good prevention measures that match with those issues. And so it's going to take some of that survey work that NCHA is doing with, it's going to take some of the work that we do, specifically deep diving into fraternity and sororities.
So what I'm wondering with local data is, in your experience and what you know happening around the country, are fraternities and sororities mainly relying on a school's overall data, say through like the National College Health Assessment, or are some fraternities and sororities even doing their own surveys that are maybe campus-wide, that are being completed just by members of the fraternities and sororities?
So, Rich, in terms of the data that we're collecting, we have a fraternity sorority experience survey. So we collect deep dive into campus communities, and or we partner with headquarters for a deep dive that they're doing their own assessment of their own organizations and their own chapters. And so that's our view from some of the things that we're doing. I'd say my knowledge of the space, that there are plenty of campuses that have homegrown surveys around alcohol misuse, protective factors, those types of things, as well as the headquarters. Heavy investment into assessment that I see a lot of the individual organizations conducting. I think the great opportunity is sharing of data and coming together with data to make sense of what's happening on college campus. I think a lot of the right hand has some of the story, and the left hand has some of the story, but we need much more of the hands coming together to really support our students in better ways, with that deeper understanding of what's going on within individual chapters, as well as within individual campus communities. And so I think that there's plenty of data, but not necessarily plenty of sharing of that data.
So bottom line I'm hearing, first of all, is, do the needs assessment, do the survey, collect the data, because you got to have that in your hand to know really what it is you're dealing with, whether it's alcohol issues, other drug issues, violence-related issues, and that connection to hazing and such. I want to follow up on the question though for you, Steve, on this, and it's really, this is more geared for the folks working out in the field. What can those in the field do to help fraternities and sorority communities around this issue of needs assessment and data collection?
Well, and we kind of teed this up, Rich, in terms of first and foremost collaborating with the students, and so you're right there, right? So collaborating with students first and foremost, collaborating with the organizations, the local advisors, the headquarters. There's so many organizations that again are collecting great data. They have really important perspectives, and just need to be asked potentially to be part of the conversation to say, hey, let's build a better understanding of what our students need. And so starting out again from that needs assessment, from that landscape assessment, and then let's look at the implementation of the educational programs and what resources the campus has, what resources the headquarters have, and those conversations. Establishing clear policies in the accountability space is extremely important. That's a lot of confusion around those spaces. At least that's what we're hearing in a study that we've conducted of conduct professionals themselves, as well as then getting into just having dialogues again with students, and having that not just be the headquarters having that dialogue or the campus advisors, but can we share in that dialogue with students to really create that deep understanding of what the issues are. So then you can then match those prevention measures with what is occurring again in those subpopulations. And I'm hitting that point again because especially for a large campus, like anyone in the Power Five that has some chapters that are pretty and have a number of chapters, right? And or those campus communities that again are smaller, but again have a number of organizations. That means you potentially have a sub-community within a community that you cannot necessarily treat all with one paintbrush, right? And so this is going to take some energy. It's going to take some resources. So from leaders in terms of assistant vice presidents or vice presidents listening in here, even presidents and trustees, this is going to take some real resources and focus energy for folks to do this landscape assessment, pull the data together, make sense of the data, and then plan out your prevention practice. And I think that's and that in a nutshell is what the center is really focused on, and really trying to build that capacity of the professional to do this work in this way.
Yeah. So again, undertones of the SPIF, Strategic Prevention Framework, but another common theme I'm hearing, I've heard you say it several times now, it's really not only collecting the data, and how you use it, but it's sharing the data, sharing the information with various audiences. It's the students themselves, it's the fraternity advisors, it's headquarters, it's the local community. the surrounding community. I mean, it's really sharing and collaborating around that information.
Yeah, absolutely, Rich. And again, in my intro, right, a couple of decades, and mostly working directly with students, advisors, organizations in a practice orientation, right? I was literally just the good old student affairs practical practitioner, and so those relationships are so key. And when you share data, just here it is, here's the trusted data we can collect, that can really change the mindsets of partners to get on the same page. And when we can get alumni, advisors, when we can get headquarters on the same page with some of our issues, magic can happen. I would say Dr. Lori Hart with Holmes Murphy Fraternity Practice and I connected about this, and one of her quotes was, students listen, and they actually will do what we ask of them. And so they'll intervene, they'll start drinking differently and things like that. But we need to ask them to that. But we all need to be on the same page when we make that ask. We can't be on different pages.
Absolutely. As I move on, you and I were doing prep for this interview a couple, 3 weeks ago, and you mentioned that the center has not only a hazing prevention strategy, but also a hazardous drinking prevention strategy. And I think many people, myself included, if we, been in the field for a while, they think these two things really go hand in hand, and perhaps they do, but is it a common misperception, and is that why the center separates the two issues with two different strategies?
Well, and I would say, Rich, we separate it, but we also combine it. So it's a little bit of a both and.
Yeah.
And so hazing, definitely some specific behaviors associated, most notably with initiation rituals. And it can encompass hazardous drinking as part of it. But the hazardous drinking has a much broader range of alcohol-related behaviors that have potentially nothing to do with hazing, right? So that's where I would say a campus really needs to engage in hazardous drinking prevention all on its own, but also then start to connect the dots and understand what the hazing practices are. Hazing is typically always commingled with another public health challenge, like violence and or hazardous drinking, or potentially both. But right in there, sometimes it's not. And so again, if you're gonna honor some different traditions, again, even just within fraternity and sorority life, there are different traditions. Some might not have anything related to hazardous drinking as part of their hazing prevention, their hazing practices. And so therefore our prevention initiatives need to match with that, right? Whereas others are definitely commingling those issues. And so it's definitely a both and approach, where we need to have distinct hazardous drinking prevention as well as looking at what those commingled hazing practices are and then matching those very specifically. And guess what? They change. So again, if you could hear an underlying theme, we need to point people on this, that really this is their job, to pay attention to the data, to nuance it by subpopulations. We can't just add this to an assistant director's job specifically within fraternity and sorority life and say, hey, go do prevention. We really need to get smarter and better at this within student affairs and resource appropriately so that we can actually create the positive change that we want. Because it's nuanced by subpopulations, right? And so cannot stress that enough, that we can really make some major change happen. But we need to do the work and the prior work and the assessment work and the landscape analysis to be able to do that work in a way that brings cultural change.
This conversation, it harkens me back to the early part of my federal career when I started at the Department of Education, Office of Safe and Drug-Free Schools, and I was running a grant competition for the first time, and we had two priorities in the competition. One was preventing high-risk drinking among college students, and one was preventing violent behavior among college students. And we were very clear in the instructions that you could submit an application that addresses both priorities, but they had to be separate applications. And that would trip people up a little bit. And what I ultimately landed on was determine for your school or your community, what is it you're ultimately trying to prevent? And in one case, it's preventing the high-risk drinking. And in the other case, it's the violent behavior. And it's sort of what I'm hearing here. The two are definitely connected, But there is, and I love what you're saying. It's not an either or. It really is a both and, but they deserve their own distinct approaches, and they can be distinct while also connecting.
1,000%. And if we can, well, try not to be political in this moment, but look at it, and again, when I say different traditions, there's literally different traditions that are also proxy to historical race and ethnicities.
Right.
And so when you're matching these initiatives, it's also potentially part of how we really pay attention to what student communities and what belonging has meant for students when they, again, is a proxy to a race and ethnicity. And then pulling back out of that within, again, communities, if they're large enough and have some distinct subcultures, they're the same potentially race and ethnic makeup, but they have distinct differences. And so it's very important, like I said, to try to find a point person that can distinguish these things, and then a point person that has a public health background, ideally, or a student affairs professional that has gained that knowledge and skills to be effective in designing those prevention initiatives that pair with those issues. And so this is some important work. And I would say classically, the student affairs folks are well steeped in student development, which is a huge part of this, right? We need student development strategies because we need conflict mediation skills. We need those leadership skills. But we also need prevention strategies that are different. And those are those bystander intervention skill training programs, the social norming campaigns, those types of things that I would say our student affairs folks aren't classically trained in. So we need to stay the course with student development, I'd like to say, enhance those efforts, build prevention strategies, the likes we haven't seen. And then also a third leg to this, Rich, is accountability strategies that really need to pair with the student development and prevention strategies, and how those three then work in concert and really have a symbiotic relationship with those three strategies: student development, prevention, and accountability.
Well, I love how you tied that up, and I think this is a nice segue into my next question, and it has to do with a review that the Piazza Center recently released, and it was a 2025 Hazing Prevention Review for campuses and organization, which when I first read about this on LinkedIn, it was probably about 3 weeks to 4 weeks ago. The emphasis is on a prevention-first mindset in building healthier, safer communities across campus. And I just, being someone who's been in the prevention space my entire 30-plus career at state and local and federal government, I loved, this emphasis on prevention first. So how do you envision colleges and universities using this document? And secondly, you can answer these separately if you want, are there plans to develop any supplemental resources to it?
Right. And I'll start with that last point, Rich, because we are working fast and furious on a supplemental guide on how to use the hazing prevention strategies playbook, as we refer to it. And really it emphasizes everything we just talked about, right? It's about that landscape analysis. It's about using data. It's not about jumping into the playbook and just cherry picking the things that you sound good. We're really trying to create a process that is related to the SPIF and the work that you all have been doing in the strategic framework, and emphasizing those things. In fact, we cite that as part of the inspiration for that work. And so that's going to be coming out, and we're very excited about that publication in the next couple of weeks, and getting that out there. Back to the hazing prevention strategies, a playbook for research-informed and comprehensive practice. First off, it's 6 years in the making. It really, actually, in the restarting or reformation of the center at Penn State, we asked the question of what do we do? How do we tackle this type of incident that was Tim's death and a hazing death, right? And so we really looked at the literature, the hazing prevention literature. We looked at adjacent literatures in violence prevention, hazardous drinking prevention, other prevention frameworks. And we pulled it all together. So this document that we have that we're sharing, it's available on our website and putting it out there on LinkedIn and the like, 6 years in the making. About 20 scholars have combed through 300 plus articles to distill it. I refer to it kind of the Cliff Notes version. Our inspiration document is absolutely NIAAA's college aim, and so we want to produce that for hazing prevention. And so all that background to say we want campuses to look at that, potentially look at it as an a la carte menu, but not jump too quickly and cherry pick some things. We want them to, again, work the steps in the process of collecting the data, doing the landscape analysis, looking at those unique issues, and then pairing those strategies appropriately. Some future work that we hope to get into with that is some case studies and some how-tos. So it's not just calling and saying, hey, you need to be doing social norming or bystander intervention skills, but how do we take those concepts and then bring them to life on college campuses. And so, again, very excited about the opportunity that this guide is. But again, caution folks on the call, especially leaders on the call, for jumping too quickly and just giving edicts to their staff of saying, do this, do this, do this, because it's mentioned in that document. We really need more of a process behind that as campuses make good decisions about building out their comprehensive prevention programs. So with that, I would say that cautionary, kind of moment. But the exciting opportunity is that these are the strategies that are percolating up that have been studied that say these are some sound practices, some research-informed practices, evidence-based practices that we should take a look at that informs a multi-strategy, multi-layer program.
I'm sitting here. I know we had discussed this, and I look forward to doing it for our viewers. We intend to post both the review and the follow-up supplemental how-to guide, if you will, on our website, campusdrugprevention.gov. There is a publications section of non-DEA publications that we post there that we think are good for your words, even the playbook, the toolbox, whatever euphemism we've always come up with for practitioners doing this work. For someone who's sitting not directly on a campus, but in some respect observing closely, it seems that this is a golden age time. I mean, because I've kind of been through that with other administrations, or just how prevention seems to align with the spotlight positively and resources that are available. So with the anti-hazing bill and this review and the supplemental how-to, this seems like a rich opportunity for, it's a confluence. Maybe it's the Steelers fan in me. It's the three rivers coming together. It's the confluence. It's the coming together in a positive way so that, campuses who have fraternities and sororities really now have the resources they need to make meaningful difference on their campus.
Yeah, Rich, I absolutely believe that. And whether it's Three Rivers or, to not use your Steeler fan analogy here, but yes, I think it absolutely is. It's where prevention science is advanced by all those thoughtful scholars that help build the hazardous drinking, the violence prevention, and that are building the nascent, the growing space of hazing prevention and our understanding of that. It's the campuses that are realizing that they need to resource this area in a more substantive way. And I would say on that point, about 5 or so years ago, I reached out to a couple campuses, Marilyn Russell at University of Texas at Austin. I called her, I gave her a euphemism title of kind of the godmother of prevention. But some other folks that have, I would say, were mavericks, and then I've been framing. We have a signature study. We have 15 campuses involved. We're actually later this afternoon we're launching our third cohort, with what we call the What Works Hazing and Hazardous Drinking Prevention Study. And so, thinking about that, we've got campuses that are pace setting, and they're looking at building those comprehensive hazing prevention programs. That did not exist 5 years ago. And so we now have folks that are dedicated. And when I said we need staff, there are campuses that are investing in creating a hazing prevention coordinator. They're putting them in fraternity sorority life, they're putting them in their health promotion and wellness area, but they're developing them. And so I think this is again, like you said, a golden age. I think it's beginning to realize that these are absolutely public health challenges that are preventable. And so when we can do the work in a positive way, in an intentional way, I should say, we can get those positive results. And so with that investment, I'm just really excited that we're part of the conversation, resourcing the conversation. The center, I like to think of us as the students and the professionals that are on those campuses or within those organizations, and then the centers behind that as a kind of foundation or support system for those folks to do their best work that then leads to positive change and behavioral change with students, which is our ultimate focus: student safety, well-being, transformational, positive experiences.
So, Steve, earlier in the interview, I heard you use the word belonging, and I wanted to zero in on that a little bit more because while I was not a member of a fraternity, I was part of a social club, if you will. And when I was in college, I was a theater major. It was a very tight clique, among theater majors. Same is true for sports teams, for social clubs. There is that inherent sense of belonging, and I know that that's true within the fraternity and sorority systems as well. Is there any research that you're seeing around this concept of well-being and belonging in the fraternity and sorority communities that can guide the work of prevention professionals on campuses?
Yes, Rich, absolutely. Strong sense of belonging and community within fraternities and sororities, both within their organizations as well as their campus community. Sororities, especially, and some emergent research on the state of the sorority women's mental health, with some funding from Foundation for Fraternal Excellence, did some work. Especially compared to unaffiliated counterparts, sorority members significantly more feel a strong sense of belonging with and fit within their institutions. And then we have fraternities as well, as with a higher proportion of fraternity members reporting really large amounts of engagement and pure accountability compared to unaffiliated students. And that's regarding academics, that's regarding hazing, substance misuse, and the like, and providing support literally in unsafe situations. So there's a lot of untold stories. There's a lot of high profile stories when it's gone wrong, but the undertold story is how much these organizations are really creating that space for belonging, as well as, I would say, peer protection and protective factors that are going on, and high levels of, I would say, some peer accountability and the like, which I think, if I may, that really creates a strong opportunity for campus folks to really partner with organizations to have that conversation, to connect them to campus resources, to help them know to walk over a brother or sister that are having some difficulties, and that's a pipeline or a bridge for some support services for individual students. But then also, how are you constructing environments and targeting those organizations that have had some situations and some challenges? And how are you then structuring environments that are really caring for their members and their guests? Because all of these organizations have dedicated themselves to caring and caring about each other and caring about their campus community as well as the town gown. And so I think there's a really amazing opportunity for campus professionals to create those bridges to support services and really, I would say, get in there to talk about the environmental plans and planned behavior that can lead to some, I think, some amazing prevention opportunities and getting ahead of spaces that can create some harm to students. So, and all under the sense of you're a space in a positive inquiry, right? You're a space of belonging. You do belonging well. Let's talk about how then you transition that into that ethos of care and concern for members and guests.
So, has there been a trend in the research, like in terms of we're seeing a greater sense of engagement and regarding belonging? Or, you mentioned sororities, for example, seems more centered around mental health issues, which again, over the last at least 5 to 6 years exacerbated likely by the pandemic with mental health issues. Has that been more of a trend that you're maybe seeing? Is this sense of engagement?
Well, I would say that there's two trends potentially, and one trend is just research in this space, and so a growing body of research to really look at the issues and how the issues are being uh, thoughtfully looked at from a research lens that is around health and safety, and about I would say how the campuses are really partnering with. Um, the headquarters and are partnering with the campuses on, hey, we're seeing all these mental health issues come into college, and so how are we addressing that in substantive ways? So I think that's one facet. I think the other facet, again, coming out of COVID, is that there's a need. Students are clamoring for a sense of belonging, right? And so I would say those two things are a really great confluence of both the support systems that are funding that research, as well as the students themselves really wanting that space of belonging. So,
Again, and admittedly, not having the experience of being part of a fraternity, but I look at it at the most basic level, at the student level. Obviously, there's headquarters involvement and creating a sense of belonging, the campus itself, the fraternity advisors, but ultimately, doesn't it come down to the student? I mean, they're making a strong commitment to serve as a proxy brother or sister in the sorority system for this sense of belonging. Is that true?
absolutely. And that's where I would say the opportunity in a motivational interviewing framework, campus professionals have an amazing opportunity to partner in that conversation, to walk alongside and guide some students, supply that a bridge to support services where we have students that are saying, hey, I've got an issue that I don't know how to deal with. So what are those mental health services, and or what are those alcohol or drug use issues that a brother or sister are having, and how do I handle that? And so I think there's an amazing opportunity for our campus counseling services, our health professionals, to really work with students to know when they need to kind of bridge someone over into the campus support services, as well as what are some of the early interventions that they can perform as peers that are, again, proxy brother and proxy sister. Because I would say that proxy is pretty close to being real brothers and real sisters, in the sense that they're practicing some really important, I would say, unconditional love. But we need to layer in what those support services are when students are in harm's way and or experiencing mental health challenges and alike. So,
So, as I come winding down our time together, I always leave this last question as, kind of the open mic I kind of kiddingly refer it to for our guest. And that's really what's the advice or the takeaways specifically that you have for the professionals who may or may not be in this space on campus, and even for the students themselves. I mean, obviously the podcast really is geared for the prevention professionals, but we do know
right.
there are faculty members out there who are assigning the podcasts as homework, if you will, to students. So we know students are watching. So what's the advice that you have for the professionals and for the students watching to help support each other in this space?
Yeah, absolutely. Well, first and foremost, we're working with brilliant students, and so I would say the opportunity again is that exercising that peer influence, one, to debunk or change misuse patterns and hazardous drinking, dangerous drinking, but potentially drug use, or potentially other mental health challenges that students are finding themselves in, right? So I would say those patterns are really important, as well as the myths that arise around those things are really crucial for, I would say, the professionals to work with students on changing those misuse patterns and or debunking some of those perceptions that students come into college with and come into fraternities and sororities with. So I would say for the professionals, that supportive environment, a non-judgmental environment where students feel safe so they can discuss these things and be transparent with staff. But then the bridging of services, as well as actually having the professionals, like I said, walk alongside the students, engage them into the planned behavior that they're going to construct some social situations. Are they going to do that in a safe manner? And are they considering a couple of different factors? Do they know some of the data that is collected by the campus on what the issues are? And can we have a conversation prior to some events so that students are grappling with that and then making some really informed decisions about what their locus of control is in terms of creating safe environments? I would say, in my lived experience of a campus-based professional for decades, when you reason with students and have a reasonable conversation with students, they all want to do the right thing. And students do truly listen when we're having honest conversations and frame it as we all want to support each other in this thing called college and in fraternities and sororities and other organizations, athletics, all the like. And so I think there's just an opportunity to really build those relationships, partner with students, bridge services, and also co-construct with them or guide them in the environments that they're creating so that they can steer away from harm and into some of the student success initiatives that we want for the campus writ large. For the students, I would say do your own research and as well as being really courageous and intervening. You'll never regret saving a life, and you'll never regret, I would say, intervening in a brother or sister's lives and or a friend's life or someone you just met in class if they reached out to you, right? So I think that, and when I'm saying by do your own research, find out what the campus issues are, find out what is really causing some of the harm to befall to your friends. And then if they are struggling and you don't feel you have the capacity or it's beyond you to support them in their substance misuse or their alcohol misuse, other mental health issues, then that's where the bridging of the support system of finding that counselor to help you out for your own support system, right? But also how do you be that friend and that brother, that sister? So I think that's, again, a great, amazing opportunity with our mental health professionals, but also just the staff that support organizations and this thing called Fraternity and Sorority Life programs or student involvement, student engagement opportunities, student leadership opportunities. And so do your own research to find what your issues are that the campus is grappling with and be courageous in intervening with your friends.
Such great takeaways there. The couple that I wrote down, ultimately, students want to do the right thing, and so do professionals. I mean, I just love that idea that you'll never regret doing the right thing. And we all do want to support each other. I mean, that's what we do in our field, right?
1,000%. And I would say that the skills, right? The competencies and skills to intervene in each other's lives that we're practicing in the collegiate environment are the exact same skills we need to build communities in the United States and abroad, right? And so thinking about this as the leadership opportunities that students have today and then where they're going to take that into tomorrow.
Steve, thank you so much for spending your time with me. I mean, I know I've learned a lot, and I figured that I would, talking about this population on campus and, information about it and the center, and learning about, it's refounding. As I said, oftentimes work in prevention comes out of a tragedy, and there's some great work that's coming out of the Piazza Center, so we appreciate that. I want to remind our viewers, earlier on in the interview, we talked about the center's recently released Hazing Prevention review and soon to be forthcoming the how-to guide. We're going to post both of those on campusdrugprevention.gov in the publications section so you have access to it. Again, Steve, thank you so much for being with us today.
Absolutely. Thank you, Rich.
Absolutely. And to our viewers, again, I appreciate you tuning in to this episode of Prevention Profiles Take 5. Check out all of the past episodes on campusdrugprevention.gov. And with that, I'm going to wish you have a great day.